Thank you, everyone, for joining us tonight for an exciting and educational webinar on IV therapies. I am so thrilled to introduce our presenter this evening, Dr. Mitchell Gunn. Dr. Mitchell Gunn has 34 years of experience in anti-aging, holistic, and integrative medicine. Along with his work in nutritional medicine, Dr. Mitch has a remarkable amount of experience as an expert clinician and researcher in the field of stem cell transplantation. In addition to being a physician, Dr. Mitch holds a master's degree in biomechanical trauma and has a PhD in nutrition and psychoneuroimmunology. He is an international lecturer on oral and IV nutrition and stem cell transplantation and is recognized as one of the premier teachers at conferences and seminars on integrative medicine. Dr. Mitch's vast academic knowledge, coupled with his entertaining delivery, makes him one of the most sought-after personalities in his field. Currently, he is a medical director for several natural medicine companies and a consultant for physicians worldwide, teaching them how to implement integrative medicine into their practices. He is the co-author of 4 textbooks, including the Advanced Guide to Longevity Medicine, the Ghen and Rain's Guide to Compounding Pharmaceuticals, the Anti-Aging Physician's Handbook for Compounding Pharmaceuticals, and the Essentials and Science of IV Parenteral Medicine. Due to the very large audience tonight, please enter your questions using the chat button, and we will do a question and answer session after the presentation. Dr. Ghen, thank you for joining us this evening. I will turn the webinar over to you.
Okay, thank you, Mom Lindsay. I appreciate all the great things you just said about me. That's so nice. And it's a pleasure to be here. I know, I'll send the present Sunday, don't worry. So I want to first tell you the most important thing that I always tell to my patients. I always give them my cell number, my contact information, because there may be other questions that come up after the seminar before, and I don't have a problem answering them. So my cell is 561-789-1588, and my email is GhenM, which is GHENM @mac.com, and I'll repeat it again. Let me go right to the point of this whole seminar that we're doing this evening, and the question. The very first question should always be asked if you're entering or thinking about doing some new modality into a practice, and that is, who benefits from it? And the answer are really several. Obviously, we wouldn't be talking about this if your patients didn't benefit, because they do. But in addition, so do their families, because our capabilities of mitigating so many different disorders plus helping patients is immense. And the last benefit, which is just as important, and I don't mind talking about it, is you. There's no question that it's an important part of my practice. It may become an important part of the practices of many that are listening to this lecture tonight, and it does come with it benefits that are remunerative. How did it start for me, I think, is where I should go. When I was an intern at a hospital back, oh my gosh, 36 years ago or more, there was a group of internists that actually got their patients out of the hospital quicker than other groups, and the only difference was, for the same illness, they were using back then intravenous vitamin C. I figured, oh my gosh, there's something that I never learned when I was in medical school. There's something there is to this, because these patients were leaving the hospital much quicker. When I started looking into it, I realized there was something I missed, and that was a functional approach to medicine. We're so ingrained in the if-then. If something happens, we'll give you this. If someone has this, we'll give them that. Instead of, what was it that kept this person healthy to begin with? What are the whys? Why is someone the way they are today? And they weren't when they were the healthiest, being between somewhere 18 and 25 for a male, 18 to 32 for a female. So I started looking back, and then if you look very carefully, which is one of the best arguments you can ever use for nutritional repletion, is the Krebs Cycle. If you look very carefully at the Krebs Cycle, you will find no medication, no diuretic, no sleep medication, nothing but those things that the cell uses to help itself. And you can look back over a good physiologic textbook and look at magnesium, manganese, biotin, oxaloacetate, and the list goes on, the essential fatty acids, et cetera, et cetera. When you couple this with the failure that we've had so many ways of helping patients with their particular diseases, and the newest journal article that just came out, it becomes obvious why IV medicine becomes so important. JAMA, if you haven't seen it, just recently reported the third leading cause of death. We used to say the fourth. Now they're saying it's the third leading cause of death in the United States. Beyond heart disease and cancer happens to be iatrogenic-created disease. 230,000 to 284,000 deaths because of the physician's hands, apparently. So what is it about this IV therapy that we can have or help people with? 88% of the people over 64 take at least one prescribed medication. Every day, 290 people are killed by some approved prescription drug, and 20% of U.S. patients are more 5 or more drugs a day. What we need to do is look at why is it we can't use just the oral medicine, because that's typical. How do we handle these complex cases using oral medication alone? The answer is we can't. And there's many reasons for that. One is the bioavailability of an orally prescribed type of prescription, such as vitamins and minerals and nutrients, is only at best maybe 20–30% absorbed, maybe 40 on a good day. But with all the medications that we prescribe, including the drugs like Coumadin and the corticosteroids and H2 blockers and proton pump inhibitors, that number is much less. So bioavailability is the first reason. And the way you can test this is very simple in a patient. The whole reason we give nutrients is because they are antioxidants. If we look carefully, are we really doing antioxidative work? And by looking at oxidative damage markers, like one that you typically do in all your blood panels, like hemoglobin A1C, when we see a rise of even 5.7 or more, it's not just because they're becoming pre-diabetic. We have the issue that they're having oxidative protein damage. And unless our program gets rid of these oxidative damage, we're not doing a good job, because eventually it leads to DNA adducts or 8-hydroxydeguanosine problems as well. With IV, we're looking at 100% absorption of nutrients. Not 10, not 20 or 30. We're going to get 100% absorption. And with the rare exception of a transport disease difficulty, which is extremely rare, these patients are going to get 100% repletion. Now, when I talk about IV, and we're talking about an IV course that's coming up with the A4M, we look at two things. First, we look at safety. Are we being safe in what we're doing? Are we giving people a safe prescription, what we're doing? And the second is, are we being efficacious? Are we just opening a clinic to give IVs so that we're having just some menu that people could take? I hope not. Or are we really trying to change the physiology and the biochemistry? And that's basically what our job is. An IV program is meant to teach you how to safely make and administer IV therapies and know when to use which and why and how. We need to also be able to side effect recognition and know the remedies that are associated with it. I think we forget that the micronutrient deficiencies that occur in human beings over time are often neglected. Melvin Werbach and myself wrote an article in one of the textbooks, someone else's textbook, a long time ago, showing that just simple deficiencies, marginal deficiencies, are where we're born. And they go through several stages until it becomes anatomic or fatal, these deficiencies, which you would know, for example, as scurvy being an anatomic deficiency which could be fatal. But the physiologic deficiencies are based in non-specific symptoms They're non-specific, the things that most physicians will wave their hand out and say, oh, you're just getting older, it's fatigue, you don't feel like the way you did before, which we could easily just say, okay, you're getting older, leave it alone, or we can find some sort of treatment protocol that could help. But the key is the difference between the physiologic and the anatomic, the difference between that non-specific symptom and one that's fatal is only one step away. So where IV nutrition shines is in almost anyone that's over the age of 40. By that time, or has a disease, only intravenous is going to replete the body with the proper nutrients. We're talking about diseases that I treat, from infectious diseases like chronic Lyme. I've treated and had the privilege of treating several cases of chikungunya, which is similar to what we're dealing with now. Stroke, cancer, addictions. The IV approach is probably one of the best ways possible to help these patients. And of course, as I said, not only does it help the patient, it helps their family, and eventually it will help you as well, because if you do it properly, it's not only prestigious and feels good, but it's very well rewarded financially. Let me give you a concept, a grand round case study that you recently had about a year ago that would help you think through it. These are the type of cases I get every day. And this was delivered to me, this case, by another physician, because I see a lot of my patients from physicians who do integrative medicine but are unable to get beyond where that patient was. This was a 63, it still is, a 63-year-old gentleman. He's executive, a very wealthy gentleman that lives in the Boca Raton area where my practice is. And he has a lot of stress, and he comes with as a non-smoker, but drank a lot of grain alcohol. He had elevated uric acid, but his problem was that he had intermittent claudication. He couldn't walk a block without having serious pain. Prior to this, he had 3 carotid endarterectomies. He sees a vascular surgeon on a regular basis, by the way, in North Carolina. And as he sees this group, they're telling him, well, we need to do this or that. Now, I want to just take you through for a moment how the traditional way we think through something as physicians and healthcare providers, and then I want to take you to how a non-traditional approach would think through this, and then I want to take you to the non-traditional approach plus the IV, because it is different. So the traditional group, vascular surgeon said, we're going to watch it. If necessary, we'll do a bypass. They put them on a couple of drugs. Of course, the statin was entered in. That's a conversation, by the way, for another time, for those of you that know how I believe or about those. The second thing is they tried to use some xanthine oxidase inhibitors. Xanthine oxidase is a very significant inflammatory type of agent. That's why you shouldn't drink milk. Milk basically produces xanthine oxidase, and it creates a lot of bleeding in the arteries all the time. They used the uricosuric agent, perhaps. They used some cardiac meds on this sometimes, and I don't recall if he did or not. They'll prescribe something like pentoxifillin, Trental, to change the shape of the red blood cells so that the cells perhaps went through a little bit easier and perhaps carried a little more oxygen. But none of these helped this gentleman, and he wanted to find another way. And the only thing that they kept doing, the group, was continued monitoring him with ultrasound and general structural studies. He then ended up in the hands of a physician who did integrative medicine. And he did the traditional, what I call the traditional integrative approach. And he did things that were natural for his elevated cholesterol. I think he used some panathine a couple times a day. He did some great dietary changes for this individual, which the patient followed. He used some anti-inflammatory that were natural. Curcumin was his choice, which I felt was an excellent choice. And then he gave him some things that were fibrinolytic, like nattokinase or Plasmanex, one of the natto being derivatives, some potassium, some K as well, some vitamin K. And he did okay. But that's all that happened. He basically stopped the progression of the disease, but there was no change. So now we have the traditional approach, which was watch and wait, gave them some things that they could do. Nothing was helping. The traditional now integrative approach came into play, where it seemed to stop the disease, which was a wonderful approach and great. And then he felt that this patient still needed to get further in his disease entity. So he says, okay, Mitch, would you take a look at him? So I took a look at him, and I said that what he did was great. I felt that what he started was amazing. But the next step would have to be, how are we going to help the plaquing? How are we going to reverse this plaquing? And so, of course, entered the IV addition to this program. And I put this gentleman on 2 intravenous treatments per week. And in 3 months, which I thought was a little bit too short, he goes back to his doctors in North Carolina, a large group that does vascular surgery. They rescan him, and the next thing you know is they say to him, I don't have a clue what happened, but this disease is now reversed. And it was about 30% less in 3 months. So they said, whatever you're doing, continue. So we did continue, and even till today, he still gets an IV about every 2 weeks. But after 7 months, he goes back to the same group, and at this point, they said, we don't see any disease. Symptomatic-wise, he now walks, does everything. He can walk 2-3 miles. He couldn't walk a block. Now, is that the typical? And you would expect me to say no. But yes, that's the typical. There's no reason the self-inflicted diseases which we have in this world, which are typically diabetes and coronary artery disease for the most part, not always, but we do play a big role in that, as well as many of the other chronic disorders can be either retarded in their presentation or they could be reversed. And by using IV therapies, we're capable of doing that. So a course of this nature, which is coming up, and of course tonight, I don't want to tell you this is not a pitch for you to come to take the course, because it is. It's basically my telling you, you need to take a course. If you want to add a different dimension to your practice, if you want to learn how to do this kind of medicine and become at least competent at doing it and know what's right and what's wrong, then this course is perfect for you. It's a 2-day course, and we go through the safety, the efficacy, what you could use, what you can't use, and we basically begin at the very beginning, and we take you all the way through. Why enter this into your practice? Why even bother doing this in your practice? Because so much malabsorption, pre and post-op, athletic reasons, distinct disease disorders from the autoimmune diseases, cancer we mentioned, coronary artery diseases, any of the cardiovascular disorders. The intravenous introduction of nutrients is spectacular and is quite helpful in addition to whatever other approaches that you're doing. So we could stand by and say, okay, well, it sounds great. We could just do nothing about it and continue doing just integrative approach that the other physician do, and you do a good job, or you can add a dimension that will make a huge difference. Now, I know there is a lot of people that are on this call tonight, and a lot of people have a lot of questions, and to answer some of them, I'm going to stop a little bit sooner than later, Lindsay, so that I can entertain as many as I can of questions that these folks may have in helping them to understand why intravenous therapy is so important. So, Lindsay, what do you have as far as questions? And let's take a few. I know we can't do all of them, but let's do a few.
Sure, absolutely. I do have a question. Will a Myers cocktail cause insomnia?
A Meyer cocktail that you'll learn very shortly is something I never use. It was originally developed by Dr. Myers a long time ago. It's a very short cocktail, and it does not replete the cells well enough because the half-life of most of the things in any cocktail is about 30 minutes. The physiologic life is much longer. But it is not enough to really replete the cells. I didn't answer your question yet. I will. If it's given late in the evening or later part of the day, it is possible that it will cause insomnia because what you're doing is you're perhaps stimulating cells that were sluggish to begin with. Now, if that person is very nutrient depleted, both mineral and vitamin, then yes, they would be more candidate for this kind of problem.
Thank you, Dr. Ghen. How easy is IV therapy integrated into the practice?
As smart as you are, I guess. It's very easy to integrate into a practice. Again, it's a matter of, do you want to do integrative medicine a little bit and just put your foot in, or you want to get into the swimming pool and swim? If you take the course, you're basically got the A to Z and are able to begin Monday morning. You'll have to read the notes another dozen times. Many of you may need coaching, and hopefully I'll coach you. But I think it is fairly easy to integrate if you have a couple things in place, which we talk about. That is, do you have the room to put 4 to 8 lounge chairs, comfortable lounge chairs? Do you have a room that can accommodate a nurse and a place where they can mix these different nutrients together? And do you have a good IV nurse? Without a good IV nurse, someone who has an amazing skill set, I would say never to do this, because this is something you would not want to stick your patients 3 or 4 times to start an IV. If you can say, yes, I've got the proper space, yes, I have a room where they can mix, yes, I have a bathroom that's close by and a sink right near the area where you're going to do the mixing, and yes, I can get a nurse that can do this, then the question is just a matter of, what are you waiting for?
Great. Dr. Ghen, what types of IV protocols will you be covering in this seminar?
Well, we start with the basic ones, not the Myers, although I do review Myers, and again, I teach Myers for the individual that's on the way to the airport. I'm in a hurry, doc, I got to go. And I teach 3 or 4 Myers, but I teach one that's the one what I call the best, which is easy Myers. It's basically 60 cc's. It's an easy 5-minute push, and they can go. I don't like it because I don't think it does what it really should be doing for that patient. But in that rare instance, and I would say rare, I would perhaps maybe see 1 or 2 a year that I would use it. We teach the normal vitamin mineral, the aggressive vitamin mineral, from the antioxidative to the oxidative. We teach for the executive. We teach for adrenal fatigue. We teach for the autoimmune. We teach the ones for cancer. We teach one for macular degeneration, which is spectacular and literally halts every macular that I've ever worked with, and often reverses it. Those are the ones that we teach. About 10 or 11 different protocols, including glutathione and a few others that are important.
Thank you, Dr. Ghen. Can you highlight the hands-on component of the IV symposium?
I would love to. I'll highlight it for you. There is none. We don't do any. Hands-on other than calculations that we do during the seminar. But as far as hands-on making the bag or something like that, we don't do. Now, if Dr. Patel will be there, and I believe he is, he does a component where teaching how to make it. And I don't know if we have that in this particular one or not. Lindsay, you would know better than I would.
Yes, we will be having the hands-on component, the mixing.
Okay, so the mixing is the hands-on component. We don't give each other IVs in this particular seminar.
No.
But there's a component of mixing a bag. We don't use the actual components. I guess we use color water. But you're trained on the proper application, which tells you that you either take really good notes and take it back to your staff, because you'll have OSHA compliant things and things of that nature, or you should bring your nurse that will be doing this program with you to that program, to that seminar. It would be great help for you.
Thank you. Another question, Dr. Ghen. Is there an antioxidant therapy cocktail that can be used in systemic inflammatory response?
Yeah, there are. Many of them are. In inflammatory response, usually the vitamin C's and in decent doses are quite anti-inflammatory. Even the American Cardiology Conference that occurred, I think it was 3 or 4 years ago, with elevated C-reactive protein, basically there isn't anything that will reduce it. Yes, you could probably get someone that's listening right now say, well, what about the statin drug, and using one of those, because there's been studies done with it. But the truth is, if you look at the study carefully, it's really it's almost nothing. But vitamin C consistently intravenously will decrease inflammation, and using other things intravenously simultaneously, like DMSO, which inhibits interleukin-8, also will decrease inflammation significantly. Again, it depends on where the inflammation and what you're treating, but yes, the answer is resoundingly yes, you can reduce inflammation significantly.
Great, thank you, Dr. Ghen. As a couple more questions come in, I just wanted to highlight tonight only, if you register for the IV Symposium, it will be happening on June 17th and 18th in Chicago. We are offering you $100 off of your registration, which will make this two-day symposium only $4.99.
But if you send me an envelope with $29.99 in it, I'll get you another $100 off. Does that work? Oh, you're not answering that one. Okay, go ahead. I'm sorry.
Again, this goes back to you know, your very dynamic personality, which we're looking forward to being entertained during the symposium. Dr. Ghen, will you go ahead?
I was going to say I definitely am going to entertain, because I always have a new stack of amazing jokes that I like to tell. I'm not going to tell a joke tonight because I can't see your faces, but don't worry. When you come to the symposium, I'll entertain you. Go ahead. What else did you want to ask me, Lindsay? I'm sorry.
No problem. Dr. Ghen, is any IV therapies covered through insurance? Can you comment on the insurance aspect?
Yeah, I'd be glad to. The IV therapies particularly are not covered by insurance. I think if you use a code inappropriately, then you'll get it covered. I said that just the way I said it because there are some people that try to do that, and I don't suggest that you do. This is a cash business. Patients will have to pay cash. No different than if you would go to the health food store and you would buy, 5 separate vitamins or minerals. There is no insurance card you're handling those people. The same in your office. It's okay as a practitioner and as a physician to get paid for your services. IV nutrition is consistently used as a cash flow. And by trying to go around the system and make a code that really isn't there, eventually that can come back to bite you. I do not suggest you do that.
Thank you. Can IV therapies be used to treat AFib?
Well, again, can you use it to treat AFib, or you can use it in conjunction? AFib, of course, you'd have to discover what the choice or what the cause of the AFib is. I mean, what's cause of it? Is it thyrotoxicosis? Is it some sort of poisoning that caused it? Is it pregnancy? What caused it? What caused that irritation? And regardless of the irritation, one of the things that we always look for is magnesium as part of that component. And magnesium often is low in individuals, as we age, let alone those who have an irritation and end up in atrial fibrillation. So yes, we'll teach about using higher doses than usual of intravenous of magnesium. And there were hospitals that did integrative medicine back years ago, and still now there are several good ER physicians that are using magnesium intravenously when someone comes in with an MI, because, as you know, the MI problems typically are caused from dysrhythmia. So the use of IV magnesium is taught in this course, and yes, it can help with atrial fib. Sometimes yes, sometimes not. Here's a perfect example where both conventional and traditional, non-traditional mechanisms will come to meet. Using CoQ10, using intravenous mag, taking things like nitrate supporters, nitric oxide supporters, etc. Plus, that person may or may not respond, may require medications, and or may require the use of a cardioconversion or ablation. So again, this is about the marriage of the things that we've learned in medical school and the addition of IV protocols. So can it help? Yes. Can it always help? No. It again depends on what's the underlying cause of the AFib.
Thank you. Dr. Ghen, we have a lot of pharmacists and compounding pharmacists on the webinar tonight. What is the pharmacist's role? How would a pharmacist benefit from taking this course?
We always have a lot of pharmacists that take this course. If they're compounding pharmacists, well, hooray, I'm glad they're there. and I think the compounding pharmacists know me. I wrote the only 2 textbooks in the world for physicians on compounding pharmaceutics. And if you're not doing intravenous preparation, and you're not a certified lab to do that, the first thing is maybe you might want to become that. Maybe you might want to learn that. The other thing is you have lots of patients that come through that are basically lost. They come to compounders or they come down to pharmacists, and they're not clear on what exactly is happening with the patient. We see the pharmacist now as a primary caregiver in the state of Florida. I'm one of the individuals that actually teaches the pharmacist for their certificate to be able to do certain integrative therapies in this state. And there is a great opportunity, whether it's just for the educational experience so that you can easily say, hey, go to Dr. So-and-so. He or she does a great job with intravenous. I think it might be helpful. That would be one thing, which was, of course, a great marketing thing. That's inner referral, and that's perfectly wonderful and great. The other is, maybe you want to team up with one of the pharmacies that are doing all of this production of these IV types of things and work together. So it's something that I don't think anyone's going to be able to get away from knowing. If you know, and you've studied the Krebs Cycle, which you have as a pharmacist, because your doctor's a pharmacy, you have no reason why you should not be studying how you're going to replete the Krebs Cycle, because the gut's not able to do that orally 99% of the time. And even though you may be purveying in your compounding pharmacy some of these nutrients, you have to know about at least if you're not doing it, how it's done to help your patients get better, and you can refer them, like I said. So it's a great course to take for a pharmacist.
Thank you, Dr. Ghen. We'll just take 1 or 2 more questions. Dr. Ghen, I know you'll be covering the revenue opportunities. Can you comment on an average sort of range of what you or what the industry standard is for a IV therapy?
Yeah, I'll answer it both ways. You should be making 300 to 400% on an IV. So if it costs you $10, you should be making $30 or $40. The average, because depending on who you use, an IV is going to cost you somewhere around, I'll say $55 on an average. That's about what it's going to actually cost you to buy the material, the bags, etc. And of course, you have your nursing time and everything else. So the average IVs run somewhere between $140 to $250, $275, depending on location and depending upon what you would like to charge for. But we do discuss economics. There's no reason not to. This is a non-CME program. Is it non-CME the one we're doing, or is it CME, Lindsay?
Dr. Ghen, I will send an email to all of the attendees first thing tomorrow with that answer.
Okay, I don't know the answer either. If it is CME, we won't be able to talk directly products or individuals or so forth. I think it was CME'd in the past. But afterwards or during, and you also have, I gave you my email, which I'll give you again before we leave, and also my cell number. There's always ways to find that information out. You can contact with me with that information. But there is a amazing revenue stream that's available for IVs. And again, I want people to learn this process so they do it right, not half. Well, I almost said a bad word, but I want you to do this correctly. I don't want it to become where people come in and get an IV and they've never had any workup or anything like that. That's going to be clamped on, I can tell you, and it needs to be looked at. But you do it right, and you will make a lot of money doing it, and you're going to help a lot of people. What better 2 combination could you ask for as a physician? Go ahead, Lindsay. What else do you have for me?
Great. Well, I think we want to be mindful of everyone's time. If anyone does have a final question, please insert it now. But I did want to thank everyone for joining us tonight. The IV Symposium is only presented once per year. Unfortunately, we will not be recording this event. There will be a hands-on component, so you're really not going to get that same experience watching it online. So I don't want you to miss out on this IV Therapy Symposium with our expert faculty. You're going to learn brand new protocols, whether you've been doing IV therapies for years or you're brand new. This symposium is for for everyone. It's a great opportunity to network, talk to the people beside you, speak with the faculty, see what they're doing, ask questions. We will have companies there that will help you to build your therapeutic toolbox. Again, we have a fantastic special tonight where you will save an additional $100. Please give me a call, email me. It has to be this evening in order to take advantage of that savings. Now, Dr. Ghen, I wanted to leave the final thought to you, no pressure. If you can finish off the webinar, that would be great.
Yeah, I'd be glad.
Please give your phone number again. We've had a couple of requests. Thank you.
Okay, so let me start with my phone number. My cell number is 561-789-1588. And my email address, which is my personal email address, is GhenM, which is GHENM @mac.com. So I'll end this with why is this all important and where do we need to go with this? You know, we live in the world of our five senses all the time. We try to constantly take care of our five senses. You know, new cars, new this, new that, and this will supply that. But more importantly, beyond our five senses is the real world that surrounds us, the 99% world, and that's the world where you can make a difference. So we could go through as average, mediocre, helpful types of physicians, or we can become great physicians. And IV nutritional therapy can take you to being a great physician. I guess at the end of the day, it's all about who and what they say. Did you leave behind something or somehow people feeling better, looking better, doing well? Did you help humanity to get healthier? It's philosophical, but I think it's worth it. Thank you so much for having me tonight. God bless everyone. I hope to see every one of you at this seminar, and happy Mother's Day to the moms that are listening. Thank you so much, Lindsay, and the A4M for having me this evening.
Thank you so much, Dr. Ghen, and thank you all to the attendees. Have a lovely evening. Thank you.